Hello, this is Dr. Stanley Lang. Welcome to this brief broadcast. And the subject, ultimately, of this broadcast will be natural Lyme disease treatment. Before I get around to that, I'm going to talk about a Lyme disease case recently that I saw. But the context for all of this is a whole person health approach to wellness, health of body, mind, and spirit. And sometimes we focus on spiritual health, sometimes physical, sometimes emotional, sometimes the intersection of the three. And today we're going to talk about the intersection of two different parts of the body. So I saw a patient today that when I first saw her several months ago, she was disabled from pain that was very much typical of fibromyalgia. And that was the diagnosis she had at the time. She had limited resources. Couldn't really do any of the non-traditional things that could be helpful for muscle pain, like physical therapy. So ultimately, we did several things, including cutting out gluten, cutting out chemicals such as glyphosate. These things helped some, but they didn't completely eliminate her pain. So we did start a trial of antibiotic therapy ultimately. And when the antibiotics were started, the brain fog that she had completely went away, and the pain diminished quite a bit, but it didn't completely go away. So I explained to her the natural Lyme disease treatment plan that I've developed, for which there's a link below this video. But at that point, I wasn't quite sure that she was going to do it or not. And then I didn't see her for several months. I saw her today for a different reason. And it turns out that her pain did completely go away, so she didn't need any other additional treatment. But a couple of interesting things she had noticed. Since she'd had the antibiotic course, which is a fairly sustained course for someone with chronic Lyme disease, she noticed that she's been getting colds frequently ever since then. And she said before that, she never got colds, but now she's getting colds every 3 or 4 weeks. And I've not seen her for any of those things. I saw her this time because of some complications of a cold that she had. And the point that we talked about was that there's a very plausible connection between her antibiotic use and her all of a sudden getting colds all the time, because the gut biome, that community of bacteria that live in our GI tract, gets markedly disturbed by antibiotics. Now it gets markedly disturbed by lots of other things too, which is a subject for other videos. But what I think happened in this case is that she damaged the first level of her immune system, which is the biome balance, the bacterial balance in her gut. And that literally communicates with the immune system that is in the GI tract, and that communicates with the immune system that's in the brain, and other communications we probably don't know about. So I think it's highly plausible that her antibiotic use, which was necessarily sustained for the treatment of her Lyme disease, has now led to this disturbance in her gut. And she's really wasn't doing an effective probiotic strategy. She thought she was, but as we discussed it was clear that she was missing several things that I normally recommend as probiotic strategies. So a couple of points from this story. Number one, she presented initially with what would have been thought as typical fibromyalgia, yet she got completely better by treating her for Lyme disease. Number two, her immune system got affected by the treatment for Lyme disease because of the antibiotics, the inevitable effect on the GI tract. And in her case, it was very clear that something had changed, because she never gets these colds, and she's been getting a whole bunch of them. So that leads me back to this natural Lyme disease treatment strategy that I developed. And one of the reasons I developed it was that lots of patients don't have access to antibiotics, even if they wanted to take them. And for a lot of people, taking antibiotics makes them sick. And this is an example where antibiotics disturb the system anyway. And so this alternative approach does not use antibiotics, but it does use a natural substance that has been clinically proven to kill the Lyme organism. So if you have Lyme disease, or you think you might have Lyme disease, or you have fibromyalgia and you think maybe this is Lyme disease, or you have any other weird manifestations that notes that your doctors haven't been able to nail down, it actually might be Lyme disease. And a trial of this particular program makes sense because it's completely non-toxic. And the worst thing that it can do is help your GI tract get a lot healthier. So hope you found this helpful. I wish you well. God bless and have a great day.